Have you driven this morning? Driven far?
All the way.
All the way?
Yeah.
You could just take a seat there for me.
Yeah.
Now I've already done your blood pressure, so I'll just get your label and hat again.
That's fair enough. Just getting touch on the door, yeah.
Right, that's right. And you're staying in a motel tonight?
Yeah.
You don't know the name of your hotel?
No, I don't. Jim does.
Yeah, we'll go.
Jim Butler.
Yeah, I'm Bob Campbell.
I'm your anaesthetist today,
Mm-hmm.
Bob. Dr Vickery's your surgeon,
Yeah.
and we're doing your right cataract. Right? Excellent.
Have to try it undone?
Just like that, that's great. That's fine, Bob. That's fine. What do you take for that?
Thank you. Red sip of water.
Do you have any heart trouble?
What?
Right, so I just have to do that for me. This one's a lot of anaesthetic care.
Dilate it up. So, yeah, you should do a good job there. Feeling fairly relaxed?
Yeah, I'm ready when you are.
Alright, that's fine.
You take more food.
What we're going to do is we're going to sit on the step and your head goes down, okay?
Yeah.
Step down.
Yeah. Oh.
I'll start with like that. You just want my coffee.
Can you put your arms down by your sides for me?
Yeah.
Great.
Super. Yeah, right then. Thank you.
What I'm doing?
Yes.
She'll make a turn incision, a small incision, of about 1 millimetre wide, which is empty, and a stepped incision. So it actually, if you can imagine, 3 steps going down into the eye. That's what she's doing. And the reason for that is when she removes all her instruments, the drops of fluid you can see from time to time on the top of the eye, assisting surgeon dropping what we call balanced salt solution into the eye to keep it nice and moist during the surgery. Crisco bites just inserting some more fluid into the layers now, and that brings the cataract. The other
I'm going to be focusing and centering it here for the surgeon.
So this is mum's eye, is it? This
Yeah.
is their eye.
Okay. First incision right on the
Right along
the edge there, just away from the blood vessels.
Yes.
Tunnels in about 95% thickness of the cornea, and then this one penetrates into the anterior chamber and enlarges the first 2 incisions. And again, that's the 3-stage incision. So the moment the instruments are out, it self-seals.
Again.
Yeah,
Right.
and that's what she wants at the end of the operation. The natural fluids have been released. A viscoelastic has been added, which expands the anterior chamber, and which is here. and a small port created for a second instrument later on in the operation.
That cataract, it more or less just covers the whole...
Well, the cataract is actually the lens behind this clear membrane here.
Back behind there again, right?
Yeah. This membrane surrounds the entire lens of the eye. And there, what we've seen there is a beautiful capsulorhexis. Couldn't ask for better. That step that we saw there is the most difficult step in the whole operation. So a fluid wave is now pumped all the way around the back of the capsular bag, so that the lens itself is now floating in balanced salt solution in here in the... So it's now ready for the ultrasound handpiece. This vibrates at 45,000 times per second. It's the same principle as a jackhammer.
Right.
And as it touches the tissue and she's engaging it now, it emulsifies it and sucks it up through the centre, and it's irrigating balanced salt solution through this port here. And as you can see, in one movement, she's broken the entire lens in half. It's called Phaco chop. This means she can remove a very dense cataract in a matter of seconds. So it doesn't matter how tough they are. You can see how thick the...
And it just sucks it up as it goes.
Well, yeah.
More or less.
Yeah, it's like cutting up a block of wood. If you go with the grain, it'll break up really easily. If you go against the grain, the surgeon will have to use this instrument to do all the work. And I've seen that sort of thing take anything from up to 45 minutes to do the same job. So...
and is that just knowing the right way to go about it?
This is the surgeon's skill,
yes.
yeah. This is... actually, that technique was developed by a Japanese ophthalmologist to break up really dense cataracts.
I mean, this must be the most wonderful thing for age phase, to be able to see it. I don't think it's...
That's right, it is. And it's simply a result of a lifetime's exposure to ultraviolet light, so it's not a disease or anything like that. So, so we have really, in a matter of minutes, the bulky cataract removed. And that's purely surgeon technique.
Sure, I'm going to like watching it. That is quite fascinating.
The iris is nicely dilated. We're looking at 65 times magnification. The three white spots we see here are the three light bulbs in the microscope. So you can see the patient's able to move their eye around.
Yes.
It's still anaesthetised, but it can still be moved around. And that's
she's able to do what...
Like if the doctor said look right or look left,
so,
the eyeball could, because the second eye isn't anaesthetised, both eyeballs move at the same. So this instrument has no ultrasound attached to it. It's purely irrigation and aspiration, and irrigates through the foot there and aspirates through the tip. So that's what it looks like in a normal person's eye, crystal clear. So she's introducing a viscoelastic, a jelly substance, massaging that little spot that had a little bit of cortex left, and expanding the capsular bag and the anterior chamber, and that's going to facilitate the introduction here of the intraocular lens.
And that has been prepared previously. Is that what?
Well,
the lens?
Yes, the lens has been at an appointment pre-operatively.
Yes.
The strength of that lens was determined by measuring the distance from where the original lens was to the back of the eye. That's tucked in. And that's sitting in exactly the same position. Simply a irrigation and aspiration there of the viscoelastic. She'll seal up the self-sealing incisions, expanding it with stromal hydration. That's where the where it comes into its own, the self-sealing incision. No suture will be required. Just test.
How did you find that, Bob?
All right.
No problem?
No problem at all.
Oh, that's
Same
great.
with this thing. Still I did, that's right. Well, that looks good.
You're terrific. Just dry now. And we're going to sit you up and take you out for a nice cup of tea. Is it feeling okay?
Good now.
Good, terrific. Come with me. I'll just take your arm there. That's lovely. We've got to make you a cup of tea.
See you later.
Hello, Jean, how are you? That went very nicely indeed. He was a terrific patient. Really fabulous. Terrific. Alright, well, sister's going to come along now and give you all your instructions about how to use the eye drops. And then we'll see you back in the clinic tomorrow. Just over in fact. Bye-bye.
I'm explaining to your daughter.
Argentina.
The eye shield that you've got on right now can come off this afternoon.
Australian one.
Right. So what if you guys could probably leave it on the exchange.
Practice apparently.
It's to stay on every night when you go to the other.
Yeah, that's right.
I want to keep your eye on having a finger pressing your eye.
When
When you take the shield off today, the line drops here, I'm going to take the